Rabies is a deadly viral disease, but the good news is it's almost entirely preventable. Learn how in this video. Rabies is caused by a neurotropic virus that attacks the central nervous system and is nearly always fatal once symptoms appear. Understanding how rabies is spread and which animals carry it is crucial for prevention. The virus is transmitted through the saliva of infected mammals, primarily via animal bites, scratches that break the skin, or contact with mucous membranes. Globally, dogs are the main source of human rabies, while bats are major sources in developed countries. Raccoons, foxes, and skunks are also common carriers. The incubation period can vary widely, and the virus has a specific pathway to invade the nervous system. The typical incubation period is 1 to 3 months, but it can range from days to over a year, depending on factors like the bite location and viral load. After local replication at the wound site, the virus enters peripheral nerves and uses retrograde axonal transport to travel toward the central nervous system. Once it reaches the CNS, it causes encephalitis and neuronal dysfunction, leading to severe dysfunction and ultimately death. Symptoms begin in an early stage known as the prodrome, before progressing into the severe neurologic phase. Early symptoms include fever, headache, and crucially pain, tingling, or itching at the original bite site, which is highly suggestive of rabies. The neurologic phase presents as either furious rabies, characterized by agitation and hydrophobia, or paralytic rabies, which causes gradual muscle weakness and ascending paralysis. While there are diagnostic methods, clinical suspicion and immediate action are vital, because once symptoms appear, the outcome is almost always fatal. Diagnosis before symptoms relies on exposure history. After symptoms, testing includes PCR or antigen detection from saliva or skin biopsy, but treatment should not be delayed by waiting for confirmation. Once clinical rabies symptoms develop, there is no reliable cure, and the mortality rate exceeds 99%. Care becomes supportive and palliative. Post-exposure prophylaxis, or PEP, is the life-saving protocol that, when administered promptly, is highly effective. The very first step is immediate and thorough wound washing with soap and water for at least 15 minutes, followed by virucidal agents like iodine or alcohol. PEP includes administering rabies immunoglobulin, or REG, around the wound for passive immunity, and a series of vaccine doses to stimulate active immunity. Preventing rabies is a public health effort involving pet vaccination, wildlife control, and personal caution. Prevention strategies focus on vaccination of domestic animals, especially dogs, and avoiding contact with any wild or stray animals. Remember, rabies is fatal, but rapid wound care, RIG, and the vaccine can completely prevent this deadly disease.